Good morning.
Hello.
My name is Anna.
Hello.
I'm your pharmacist. Will you verify your name for me, sir?
Joe Smith.
Thank you, Mr. Smith. Your doctor's ordered you a new inhaler.
Okay.
I'd like to go over it with you and ask you a few questions if that's okay.
Sure.
Do you have any allergies, sir?
No allergies.
Thank you. And are you on any other medications?
I have that other inhaler.
Ventolin, if I remember from your
Yes.
profile? Thank you. And any over-the-counter?
No.
Nothing? Aspirin? Okay, great. This is a little different from your other inhaler. This
Okay.
is not a rescue inhaler, it's a maintenance. You'll have to take it twice a day, scheduled about 12 hours apart. It's called Advair. It's made up of fluticasone and salmeterol. That's just going to help with symptomatic relief. It will open up your airways and also decrease inflammation.
Okay.
Since it's a powder, you have to hold the inhaler a little differently from your multi-dose. You don't want to spill any powder out, but it's very easy to use. I'll show you and then we can have a return demonstration. To open it, you just place your thumb and push.
Okay.
You want to keep it flat and level, and you'll need to activate it by pressing the lever till you hear a click, and that will change your dose counter.
Okay.
There are 60 doses in here. That helps you with twice a day dosing. It's a 1-month supply, so this should last you a month. It will click down every time you activate it. Another way to keep track of it is there's 2 lines for dates, the date you open it and a 30-day expiration date. It's good to get in the habit of writing that down just in case you miss a dose, which you will never miss a dose. It will help you keep track.
Okay.
If you do miss a dose, the manufacturer recommendation is not to take the dose when you remember. Wait till your next scheduled dose and just continue on your schedule.
Okay.
Okay, so holding this flat and level, you have your mouthpiece.
Mm-hmm.
When you make a seal, you want to put your lips around that mouthpiece and you want to inhale through your mouth. Make sure your tongue is depressed so the medicine goes into your lungs and not under your tongue.
Okay.
So first you'll do a deep exhale away from the device. Turn back towards the device. Put your lips around the mouthpiece, seal. Quick, deep breath. Hold for 10 seconds or as long as you feel comfortable for. When you're done, you're just going to turn it back. You can use your thumb or your forefinger, and that will reset it for next time. Since this is a dry powder, you don't want to store it in any humid area, so it would not be stored in your bathroom because when you take a shower, it will affect the powder, and you won't get as much of a dose with your next inhalation. To clean it, it's very easy. Don't want to submit it again, no water, but you can just take a damp alcohol on a cotton swab or just even a washcloth with a little bit of soap, but just keep this area wet. Try not to get any water in the mouthpiece. You may notice that you have a little bit of throat irritation or a slight headache. Those are very common side effects. Nothing to worry about. If you do get a rash or have trouble breathing or any kind of swelling in your mouth or lips, you need to stop the medication and call your doctor immediately.
Okay.
Do you feel comfortable with it?
I think so.
Would you like to return demonstrate for me?
All right.
Thank you.
Okay, so I open it up. Okay, and I press this to activate it. I take a breath out. I hold it for as long as I can, for 10 seconds at least, and then I return this.
Perfect.
Okay.
This will take about a week for you to start to see some of the effects of it. So I would like to do a follow-up call with you if that's agreeable to you.
That'll be fine.
Okay, so again, don't expect tomorrow you'll get up, you'll be able to run a marathon. It's going to take about a week for you to feel a little bit of ease in breathing.
Okay.
And I'd like I said, following up with you just to make sure that you are feeling something.
All right.
Okay. Okay. Do you have any other questions, Mr. Smith?
No.
I appreciate your time. Thank you for coming to the pharmacy.
Thank you.
Bye-bye.
Bye-bye.